Just have them tested before you do that.
1, 2, 3 testing. Okay, well, I'm going to start again. I think many of you couldn't hear me, just saw me on my, if you could lip read, you could hear what I just said. Well, this is Fridays with Feldman again, a little unusual circumstances in the world of that we're living in this unusual time with COVID. And I'm really going to talk to my patients mainly and talk in general about orthopedic surgery and maybe answer some questions and go through the sequence of events of what's going on, at least here at Paley Institute, as well as around the world for orthopedic surgery and specifically with what I do. So orthopedic surgery in general, as you all know, is mostly a quality of life profession. We're trying to help quality of life, eliminate pain, improve function. Right now, hospitals are deferring to saving lives and allowing people to be cured from this virus, to be cured from this condition, to allow the resources of the hospital to be able to use the ventilators and to be able to use the oxygen tents and what they need to be able, and beds and hospital beds for COVID and not for non-urgent surgery. So we have stopped, or I've stopped doing non-urgent surgery. I am not doing scoliosis surgery or surgery on arthrogryposis or even on MHE. Certainly if we have an emergency come in or we have something that has to be done, we can operate. Our operating rooms are functional. There are beds available. So that's not a problem. And we certainly have the resources within Tenon and within these hospitals to function quite well. But we are deferring because of what may happen over the next couple of weeks and what is happening now to allow the infectious disease specialists, the pulmonologists, the internists to do their work and to get us through the next month or the next number of weeks so that we can get over this huge world problem. In terms of, I'm going to talk about a number of issues. First of all, I want to answer some questions about, I've been asked online, whether or not some of my patients are at increased risk for COVID. So I treat a number of unusual conditions. Any condition that will involve your lungs certainly could put you at increased risk. So neuromuscular diseases, such as arthrogryposis and cerebral palsy, certainly if it involves the chest wall and if it involves breathing, it may put the person who gets COVID at some increased risk. However, most of these patients are healthy otherwise and would probably do fine, and there's no proof of this. But that's one of the reasons I stopped doing scoliosis surgery a couple of weeks ago, because that may put stress on the chest wall, and I didn't want to take the chance for my patients. But this will resume after this crisis is over, and we'll begin in full and doing that, and I'll speak about that at the end of this. MHE, multiple hereditary exostosis, absolutely no proof that that condition puts you at increased risk. Dwarfism or skeletal dysplasia, again, no proof that that puts you at increased risk unless you have an underlying lung complication as well, and there are some dwarfing syndromes that have that and you know who you are, and then you are at increased risk like anybody else. In terms of going on with treatment, how do you continue on if you can't get to a physical therapist? We treat patients from around the world. How do you get to us? Obviously, it's very difficult right now. Our physical therapy is open. We are treating patients here, but if you can't get to us, most of you send you home with discs. Many of you are your own therapists. Many parents can treat the children. Spouses can treat their spouses. And I think that is very helpful. If you have questions or if you have concerns, we can do telemedicine. Telemedicine is being insured by many of your major insurance companies. I don't think it's terrific for physical medicine, such as orthopedic surgery, but it does put patients' minds at ease at times. I can meet with you and talk to you, have an appointment, and my office can help you with that. We can review exercises with myself or with physical therapy. And you can reach me through the phone, through my office, or through email, which is dfeldman, one word, at paleyinstitute.org. That's dfeldman@paleyinstitute.org, and we'll try to get back to you. My team is still functioning, and we are working and still seeing patients on Thursdays, as many as can come, for continuity of care. However, certainly this is going to take its toll. Afterwards, we're going to be up and running this entire summer. I have a junior partner joining me in June, and we will be up and running full force to try to catch up on the patients that we had to cancel and we had to move to a later date. And we will work with you the best we can. We will not punish you for the cancellation. We're just trying to accommodate all, and we will. We will work straight through the summer and straight through September to try to catch up on all that is going on. And again, email us. We can do telemedicine, and so we will be functioning. But most of you are not at increased risk. Most orthopedic patients are not at increased risk for COVID unless you have other comorbidities. I'll talk about a couple of other things as we go forward. One is that moving forward, obviously, I just lost my train of thought. No, I think that within physical therapy, I think that is becoming a real problem for my patients, but you won't be lost in that. And again, we can do that and teach you exercises via telemedicine. I think that something an infectious disease professor of mine taught me once was that a virus is like a hurricane. And for those of us who live in Florida or even New York recently, you know what a hurricane is. You spend this time preparing for it. You shudder in, you buy all these objects, and then the hurricane hits. And there's all these different models that tell us how the hurricane's going to hit and where it's going to hit. And none of them are fully accurate, but they certainly scare us, and they're certainly very scary. And we're going through that period of time now. But we do know that people have to abide by the recommendations of state and country authorities during a pre-hurricane. If they don't, you put your first responders at risk. You put all of us at risk. So I do advise you all to watch that. But like hurricanes, viruses end. And then afterwards, we have to clean up the mess. And that is the best analogy I can give, or metaphor that I can give for what's going on. It truly is a hurricane. It's happening. It is raining now and the winds are blowing. But we will get through this, and this too shall pass. So I took that expression of this too shall pass, and since we treat patients at Paley Institute from 90 countries, and all the states of this country, I thought I would tell my patients that something that is a Persian adage. It was coined in the Middle Ages in Persia. It was brought into a vernacular by Abraham Lincoln during the hardest time in American history, during the Civil War, when he used that expression of this too shall pass. And I sort of view this in all languages. So I'll say to all my patients in Spanish from South America to Spain, so esto también pasará. To my patients in Israel, Gamzei Avo, to my patients in Kuwait and the UAE and Qatar and Saudi Arabia, Kohaja Sayamor, to my patients in Poland who I will not be able to see, hopefully we'll be able to see again in the next couple of months, Tot Tezminya, I hope I said that correctly, to the patients from China, Chichichan Koche, and to all of you around the world, and to all of us, I'm wishing you the best of health, and this too shall pass. So this is David Feldman with Fridays with Feldman, wishing you health and safe journey through this tough battle. Thank you.